Hello guys, today we're going to talk about the systemic lupus erythematous. So this is the autoimmune disease. So there is an immune complex formation and this deposit on our body parts and they destroys the cells and tissues. They mostly affect the skin, kidney, joints and many other parts. So here's the picture of SLE, and this resemble to the typical butterfly shape. So you can see on the cheeks, if you draw the outline, they resemble to the butterfly shape. And if you are new in this channel, please like and subscribe. That would be highly appreciated. So let's get started. So it is the autoimmune chronic disease characterized by autoantibodies, immune complex formation, and immune regulation, resulting in damage of essential organs like kidney, skin, blood vessels, CNS. So this is the autoimmune disease. So the immune complex, they attack our body itself, and it is a chronic disease that occur in the long duration. It does not occur suddenly, and it is characterized by autoantibodies, immune complex formation, and immune regulation. So these antibodies, they are formed automatically and they form immune complex, and this immune complex causes damage of essential organs like kidneys, skins, blood vessels, CNS. So this is also type 3 hypersensitivity reaction, where there is immune complex formation in the normal tissue of human, and this attract leukocyte attraction, leading to destruction of cells and tissue. So SL is another type 3 hypersensitivity reaction, and in type 3 hypersensitivity there is an immune complex formation. So this immune complex, they deposit in the tissue, and these process attract the leukocyte. So the leukocyte comes to that place and they start destruction around those areas. So the cells and tissues around this area get destructed. So this is the automatic process that regulated by immune system. Let's see the etiology of SLE. So the exact causes of SLE is unknown, but there are several factors that may be associated with disease, such as genetic. So the disease isn't linked to the certain gene, but people with lupus often have family member with other autoimmune condition. So uh, if your family has some autoimmune condition, then there are high chance that there may it may predispose the SLE condition. Also, environment trigger the SLE, such as ultraviolet rays, UV rays. So UV rays has potential to trigger SLE. Also, certain medication can also causes SLE. Also, viral infection and physical and emotional stress. So if you have a lot of physical and emotional stress, then it may also uh, trigger the SLE. Also, trauma could trigger the SLE, and sex and hormone imbalance also could trigger the SLE. SLE affect more in women than male. Estrogen hormone play important role in having SLE. So if we compare the male and female ratio, it is more common in women, because women, they have estrogen hormones, and this play important role in maintaining. This play important role in having SLE. Let's see the risk factors. So if you see the risks, they are more common in people of Africans, Asians, Native Americans descent. They have more chance of having SLA. And if you see the chance, it is of course more in women, as they have the estrogen hormones, and they provoke this estrogen hormone provoke the SLA. So it is more common in women. Also, if you see the age, it is more common at the age of 14 to 45 years. That is middle age women are mostly affected. Also, family history play important role in risk factors, such as if your family member have any type of autoimmune disease or history of lupus, then there are high chances of developing SLE. Also, if you have frequent contact with virus or chemical, it may trigger the lupus. Let's see the clinical features. So this occur at the middle-aged people between 30 to 40 years, and if you see the rest, it is sex. If it is more in women than male, so female more than male 2:1 before puberty. So before puberty it is less because the estrogen hormone are not fully developed, but after puberty the ratio is increased, that is 4 is to 1, as the estrogen hormone are well developed in women, so it is more in women. And lupus can affect any part of the body. So this can affect any part of the body, mostly they affect the skin, kidney, blood vessels, also nerves. So the common symptoms include achy joints, so the joints are very painful, so it is also known as arthralgia. And the joints also become swollen, so there is a swollen and pain in the joints, which is swollen joints is also known as arthritis. Arthritis is the inflammation and swelling of the joints. Also there is a fever which may be higher than the 100-degree Fahrenheit. And also the constant and severe fatigue, so you may get tired easily. And there is a skin rashes around this body part. Also the ankle swelling, so the ankle around becomes swelled. Also there is a pain in the chest when you try to breathe, and this term it is also known as pleurisy. So when you try to breathe deeply, you may feel the pain if you have SLE. Also the most common sign is butterfly rash. So around the cheeks you may see the butterfly shaped rash around the cheeks and nose, and this is also known as malar rash. As you can see in the picture, there is a rash around the nose and cheeks, and if you see draw the outline, this resembles to the butterfly shape, so this is also known as malar rash. Also there is a hair loss from the scalp or genitalia or axilla. And people are very sensitive to the sun or other light, so if you try to go outside in the sunlight, this may trigger the rashes and SLE. Also other lights such as UV light trigger the SLE. And person also may have seizures sometime. And mouth or nose sores, petechia, so there is a frequent mouth and nose sores. Also petechia means pinpoint bleeding. Also there may be dysphagia, which is difficult in swallowing. And pale and purple fingers or toes when you are cold or stressed, so your fingers become pale or purple color when you are stressed or cold. You can see the in the picture there are pale and purple color fingers, probably due to stress or cold. So this is typical features of SLA, and this phenomenon is called Raynaud's phenomenon. And you can diagnose the SLE by looking at the sign and symptoms. So the typical sign is a malar rash, so there is a butterfly rash on your cheeks. So in the SLE there's a typical butterfly shaped rash around the cheeks and the nose. Also there may be discoid rash. Discoid rash means the red scaly skin patches that causes scarring. So there may be red patches, and over it there may be scars. Also person is very photosensitivity, so if you try to go into the sunlight or any types of light, they have very sensitive to sunlight, there may be rashes or other problems. Also there are a lot of oral ulcer around the oral cavity, and these ulcers are open. Also there is arthritis, that is the inflammation of joints, pain and inflammation and swelling of the joints. Also there is a kidney problem with either red blood cells or extra protein in the urine, and if you take the urine test, there may be a lot of protein in the urine. Also there is an inflammation of tissue around the lungs, which is known as pleuritis, or around the heart, also known as pericarditis. So inflammation around the heart is pericarditis. Also there may be blood disorders, so the red blood count is lower, that and the condition is known as anemia. Also sometimes white blood count may be low, which is also known as leukopenia. So penia means less and leuko means white blood cells, so leukopenia. Also sometimes fewer lymphocytes, so lymphocytes, which is also known as lymphopenia. Also fewer platelets, which is known as thrombocytopenia. Also, immunological disorder include certain cells or protein or a false positive test for syphilis. So this is an immunological disorder, and sometimes it gives false positive test for syphilis. Let's see the treatment of SLE. So in most of the cases, steroids are used. So steroids, they are mainly used to suppress the inflammation, and you can put the steroid cream directly on the rashes. So if you have rashes, you can put them directly on, and they are usually safe and effective, especially for mild rashes. So they have a very less side effect for and they are safe. Also, low dose of steroid creams or pills can ease mild and moderate signs of lupus. So that's why steroids are mostly used for mild and moderate lupus. Also, hydroxychloroquine is used, and this medicine helps to control mild lupus related problems such as skin or joint disease. It can also prevent symptom flares. So flare means the burning sensation or inflammation. So hydroxychloroquine are mostly used for these kind of problems such as skin and joint disease or flares. Also, cyclophosphamide is used. So this is the cancer drugs. This chemotherapy drugs also weaken the immune system. So this cancer drugs works by suppressing our immune system. As a result, they cannot auto form the autoantibodies, and thus they suppress the immune system. It treats several forms of lupus, such as those affecting kidneys or brain. So cyclophosphamide, they they are used to treat the lupus which affect kidney or brain. Also, azathioprine. So this is another immunosuppressant drugs that are used to treat the serious symptoms of lupus. So if there is a serious condition, this azathioprine is used, and it was originally used to prevent rejection after organ transplant. So this immunosuppressant drugs, most they were originally used when there was an organ transplant to make it more successful. But nowadays it is also used in many autoimmune disease. Also, methotrexate is also used, another chemotherapy drugs that weakens the immune system. So this immunosuppressant drugs, this works by suppressing our immune system, and nowadays more drugs doctors are using it for skin disease, arthritis, and other condition that does not get better with medication such as hydroxychloroquine or low dose of steroid prednisolone. So nowadays this drugs is very popular among those patient who doesn't who doesn't respond to the hydroxychloroquine or low dose of steroid prednisolone. Also, vitamin and supplements are necessary, such as vitamin C and D. Antioxidant may help with symptoms and boost your overall health. The omega-3 fatty acid in fish oil also might be useful. So there's the vitamins and nutrition supplements should be optimum as possible. Also, androsterone, this hormone may lessen symptoms flare up but can also have mild side effects like acne and hair growth. So this hormone can be also used to decrease the symptoms, but their side effect would be acne and hair growth. Also, acupuncture are used in some cases. Small studies shows that acupuncture can lessen pain and fatigue. Also, mind body therapy can be used to decrease the symptoms, such as medication could ease the pain, as well as mental health issues such like depression and anxiety.